This week 105, the last Saturday, and my name is Dr. Ross. I'm one of the chiropractic physicians here at the World of Wellness, and today we're going to be talking about stretching. Let's just face it, I feel like in today's society, everybody's very sedentary lifestyle, a lot of sitting. And a lot of basically forward posture. So we're going to talk about some of the things that you could do, very, very easy, simple exercises and stretches at home to kind of alleviate any kind of tightness, stiffness you're having. And then I am going to call Phil up, and I'm going to show basically what we kind of do in the treatment room to kind of enhance it. So yeah, today we're basically just going to be talking about stretching. I'm going to be moving around here today and show you some things you could do at home, and kind of show you what we do in the clinic as well. Just a little bit more bang for your buck, if you will. So first, I just kind of wanted to talk about the different types of stretching. So we talk about different types of stretching. There's a decent amount. So you have what's called an active stretch. So an active stretch is when you grew up and you were playing football or soccer, and the coach, you're in a circle and you go down to touch your toes to stretch your hamstrings. That's an active stretch. You're actually doing it yourself. And that is different from a passive stretch. So what myself and Dr. Orbach do in the room, we do a little bit of both. We'll actually basically teach patients how to stretch the correct way at home and how long to hold it for. And then we do a lot of passive stretching as well. And when we talk about the passive stretch, there's like two components to it. So a passive stretch, we also do something called, stands for FST, it stands for fascial stretch therapy. And why I think patients get a lot of bang for their buck for the FST is because your fascia is like connective tissue. It's kind of like a pantyhose that wraps around your muscles. And a good way to think about it is that if you have you have three fascial lines. So you have a frontal, a posterior, and a lateral fascial line. So sometimes when people are having any kind of like knee discomfort, and some docs will just jump straight to the knee, it actually could be coming from like a myofascial impingement in your hip or a little bit down the chain, so to speak, in your ankle. So what I like to do is not only work on the actual muscle belly themselves, but I also like to kind of work on the fascial tissue, just so we kind of hit everything 100%. So that's some of the things we do in the room, the fascial stretching. And then what I'm going to go into heavy today is something called pinning and stretching. And pinning and stretching is something that you as a patient can do at home, and people get a lot of relief. I have a handful of patients that I'll see once or twice a year because they'll come in from a bad migraine. And I usually just give them like two different things that they could do at home that really, really reduces their symptoms. And it kind of keeps them from coming back in, once a month, every other month. And basically they just do some of these stretches and some of these pin and stretches at home, and it really, really alleviates your pain. And we'll kind of talk about the pathophysiology that goes into that too. So what I was thinking for today is we're going to kind of just work from the top down. So we'll kind of start with cervical spine and then kind of go all the way down. And then Phil has a picture up on the screen, which we could put up a little bit later. It seems like almost everybody today has a little bit of the upper cross and lower cross syndrome. So I started the topic talking about how we're a very sedentary population right now, because you're usually sitting most of the time, right? You're sitting in your car, then you're going to sit at dinner, then you're going to sit at a movie, sitting at home. And with all that prolonged sitting, basically you're going to tighten up certain tissue that you don't want tight, and then certain tissue is going to kind of turn off because we're not active. So we'll kind of talk about upper cross syndrome and lower cross syndrome and what you could do at home to kind of to kind of correct that. So we will just start, since I already talked about the headaches, we'll start about talking about like a tension type headache. So a lot of patients coming in, Dr. Phil, I've been feeling pretty good, but I kind of feel a little bit of tightness in my neck, and now I'm getting a headache that's kind of wrapping around kind of in my temple region or behind my eyes. That is called a tension type headache, and where that's actually coming from is something called your suboccipital triangle. So you have four small muscles, and we'll just call it your suboccipital triangle, that kind of right off your occiput, like right at the top of your neck. And a lot of times patients coming in, those are very, very sensitive and they're very, very tight. And so what we could do to start with that is it's just a very, very simple exercise that you could do at home. It's called the pin and stretch of the suboccipital muscles. So if you have headache frequencies anywhere from like one a month, one every couple weeks, this is going to be huge for you, which you could do at home. And Phil, I'm going to try and do this with the microphone. So the suboccipital stretch, very, very easy. And before I start with this, I just want to tell you guys, like when you're doing these pin and stretch moves at home, you get the most bang for your buck the last 15 degrees of the range of motion. So a lot of people, when I'll tell them to do these stretches, they'll kind of just go through like an abbreviated range of motion. But I can't stress this enough. You get the most bang for your buck that last 10 to 15 degrees range of motion. So we'll just start with the suboccipital release. And so if you're sitting at home and if you currently have a headache, this would be a great one to do now. Or if you just carry a lot of tension in your upper traps of your neck, which basically everybody does. So very, very easy. And maybe it's just good if I just kneel down right here. You still see me in the camera? Okay, so when we talk about the suboccipital release, what you're going to do is you're going to go with two strong fingers, and you're going to start with your head into extension, and you're basically going to look back as far as you can. You're going to take those two fingers, you're going to slide off your occiput where you feel those tight and sensitive muscles. You're going to push very hard with two fingers, and then you're going to drive your chin down towards your chest. And what I was getting at earlier was I say a lot of patients, they'll just do this at home. They'll go and they'll kind of stop once they get horizontal. You don't want to do that. You get the most bang for your buck going all the way down through the full range of motion. I cannot stress that enough. So if you're suffering from any kind of like upper neck or upper back or trapezius tightness, this is a great one to start with. So again, you're going to look all the way up, two strong, heavy fingers, push into that tissue, and then you're going to drive your chin all the way down towards your chest. And once you get all the way down, you're going to pop off, and then you reset. And when I give this to patients to do at home, I usually recommend anywhere from like 8 to 10 repetitions and try to do that 3-4 times a day. And basically what that's going to do is loosen up those suboccipital muscles. And if you have any kind of headache or just any neck tightness, that's going to significantly reduce it. And so then we'll just go right into where everybody basically holds their tension is their upper traps. So, yeah, basically everybody coming in, yeah, I just feel stressed, I'm tight, and I just feel like it always goes to the top part of my shoulder here. A very easy one you could do at home as well. So for this one at home, yeah, you can, absolutely. Thanks, Phil. So at home, what you could do for, actually I should be good with this one because I'm only going to be using one hand. So if we're going to be working on your right upper trapezius muscle, a lot of people have, they have a lot of trigger points in there. So what you could do, you could kind of just palpate and feel into your upper trap where it kind of feels the most tight. And the side you're working, that's the side you're actually going to move your ear towards. So if I'm working on my right trap, I'm going to go with two strong fingers on my left hand. You're going to go ear to your shoulder, and you're going to find where you're feeling the most sensitive. You're going to pin down really hard with two fingers, and then you're just simply going to take your left ear to your left shoulder, pop off, and then reset. And again, a lot of people are holding tension in their upper traps, and there's not like a really good way to kind of release some of this tension. So this is a really, really good thing that you could do at home. Very, very simple. And I guarantee you, if you start to do this, 5 to 6 times a week, and you do this for like consecutively a month, I guarantee you, you're going to have increased range of motion of your cervical spine, and then the tightness in your upper traps is going to really start to kind of mellow out. So again, the biggest thing with this too is you want to go through the full range of motion. I'll usually ask patients like, oh, have you been doing those exercises at home? Yeah, well, let me see you do it. And then they'll go and they'll kind of just stop once they kind of get back vertical. The biggest thing is you really want to drive that left ear as far as you can to the shoulder because you're taking the muscle through its full range of motion so you could really get out that trigger point. And I guess I could just touch base on what a trigger point too is. So all your muscle fibers, they should be oriented linear, so they slide very well. Like when you have a knot or a trigger point, it's basically that your myofascia in the muscle kind of gets like basically just into a ball, right? And so it doesn't, the actin and myosin filaments don't slide how they should. They should slide like this. So when you're doing some of those pinning and stretching at home, and then what I also do in the treatment room is I have something called a Graston tool. It stands for Instrument-Assisted Soft Tissue Immobilization. Long story short, use this fancy tool to kind of go over the muscle, and it's going to help the fibers to organize in a more linear fashion, so you're not going to have that tight trigger point. It's going to get more linear, and you're going to have better range of motion. And then what we'll do is we'll dive into the upper cross syndrome. So Anybody that's working from a computer, and let's face it, everything we do in society is always in the seated position. So usually what happens, whether you're eating, driving, texting on your phone, everybody is basically doing everything in a forward flexed posture. So what happens is your shoulders really want to round forward. And there's certain things that you do at home to correct this, and then certain things we do in the treatment room as well. And in a nutshell, upper cross syndrome is basically where your deep neck flexors get extremely weak. Pec minors get really, really tight. Upper traps get really tight, and then something called your serratus anterior, they also call that the boxer's muscle, that gets weak, and so then people will kind of have that forward flex position kind of like this, and we'll kind of show you how to undo that right now. And I can't stress enough, like in the treatment room, I do a lot of that pinning and stretching, just because your pec minor, where it attaches to your sternum and then up in your shoulder, if that gets crazy tight, it's going to pull your shoulder forward. So usually what I instruct patients to do, just to start, is just a prolonged pec minor stretch. It's going to be kind of hard to do since I don't have a door here. Can I use my door? All right. So Phil's going to be my door frame. And when I instruct people to stretch at home, growing up playing sports, right? I played soccer my whole life, played in college. And unfortunately, when you go to stretch, if you're going to go stretch your hamstrings, you basically go down, touch your toes for 10 seconds. You have something called a GTO and a muscle spindle. And so when you're actually stretching at home, make it very purposeful, and you want to hold your stretch for about 40 seconds. Because when you have the time under tension for 40 seconds, it's going to kind of reset that muscle spindle so that muscle could actually elongate. So for a simple pec stretch, if Phil is my my door frame here, I usually have people start a little bit lower, and then what you're going to do is you're going to place your arm extended, lean away from it, and then to get a little bit more of the fibers, I'll instruct patients to kind of look up and away, because that will kind of get into your cervical spine as well, those deep neck flexors. And then again, I would instruct people at home to kind of hold for anywhere from 40 to 45 seconds. That's where you get the most bang for your buck. And I'll have them do 3 parts. So I'll have them kind of go low for the low pec, and then I'll have them kind of go straight horizontal, and then I'll have them go a little bit higher, and then you're just going to lean away. And when you're doing these at home, you want to make sure you hold for around 40 to 45 seconds. And so once you get the pec loosened up, the next thing you're going to do at home is the trigger point release. So it's that pin and stretch of the pec. So if you're sitting at home, can you maybe hold this one? So at home, what you could do is, so essentially the pinning and stretching is you're shortening the muscle, pinning it and stretching it back out. So I would suggest stretching your pec, those 3 different ranges of motion, around 40 to 45 seconds. And then again, 2 strong fingers. You're going to start with your arm straight out in front of you. You're going to find where you're kind of sensitive in that pec minor. You're going to push, and then you're basically just going to open up just like this, full range of motion, pop off, and then you're going to reset. And so once you stretch your pec minors out and then do some of this pinning and stretching, over time, you got to be diligent with it, about 3 to 4 times a week. And if you do that around 4 weeks, you'll realize that your shoulder, instead of being stooped in a forward posture, since that pec minor's releasing, your shoulder's naturally going to fall back, and then your anterior head carriage is going to kind of come up too.
In that stretch, does it matter how you hold your fist? Does it have an effect at all? No,
yeah.
Doesn't matter.
Yeah, fist doesn't matter. Yeah, you're just gonna go. Great question. You're just gonna go with a straight arm, and then you're gonna basically again take your arm as far as you can. You're gonna push, and then you're gonna open all the way up here. And fair warning, when you do these at home, they are gonna be sensitive, because again, everything we do in society is basically in front of us, so the pec minor gets crazy tight. So I would highly suggest. Thanks, Phil. When you're doing those at home, I would say start with light pressure, because it's going to kind of get sensitive, and then you could increase your pressure as you go on. And for those, we were talking about holding the stretch for about 40 to 45 seconds. And then when you're doing the pin and stretch, I usually recommend patients to do anywhere from like 8 to 12 repetitions, and you could do that 3 to 5 sets a day. And just this very, very easy motion and easy exercise is going to take your shoulders from the forward flexion back here. And so we kind of went over the tightness in the upper trap, and we went over the tight pectorals, and then it says weak lower trapezius. So one of my favorite ways to strengthen the lower trapezius is actually using a band. So I got my band right here, and this is a lower trap activation. If you guys don't have these bands, you could get them on Amazon. They're like $5 or $10. They're not going to break the bank whatsoever. Can you maybe hold this? Sorry, Phil. Yeah, so for the lower trap activation, so your trapezius muscle is a massive muscle. You have an upper, a middle, and a lower trapezius. Everybody is very, very tight in their upper trap. We went over what you could do at home to release that. And then a little bit of yin with the yang. If we're going to loosen the upper trap, we got to strengthen the lower trap. So very, very easy. You're going to grab your band at home. And what you're going to do is you're going to start with palms facing you, and hands are going to basically be shoulder width apart. And I think this might be better with a side view. And so what you're going to do is you're going to bring the band kind of into your midsection. You're going to pinch your shoulder blades, and then you're just going to drop your shoulder blades down. And if you do this correctly, you'll start to feel a little bit of a burn right under your shoulder blades. And that is basically strengthening up that serratus anterior muscle, the boxer's muscle, and your lower trapezius muscle. Okay, yeah, and I'll show you guys this other side. So you're basically just taking the band right into midsection, squeezing your shoulder blades, and then you're dropping the shoulder blades into your back pockets, I like to tell patients. And basically what this is going to strengthen that lower trapezius muscle, and a little bit of yin with the yang. The stronger the lower the trapezius muscle gets, it will kind of turn off the upper trap as well. So that's kind of how to correct that. And then the last one, so the weak, deep neck flexors. How I like to instruct patients of this is to kind of like basically strengthen the deep neck flexors. Think of someone real ugly trying to come kiss you, and you're basically just backing up like this, doing a double chin. So that's the easiest way, I think, that to kind of instruct patients. So you're literally, and then if you kind of want to use a finger to kind of reinforce it, you're going to do a double chin, and you could actually use your finger to kind of push back as well. Because again, we're all sitting kind of like this, right? So we're going to try and stimulate those deep neck flexors and get you from the forward flex posture a little bit more erect and getting the shoulders back. So that's the basic way. And then to make it a little bit more challenging, you're actually going to be laying prone. So you're going to be laying on your belly. Phil, I might need you for this one. All right. And so this is the a little bit more advanced way. So you could start with doing it in the seated position, but where you're going to get the most bang for your buck is laying on your belly, and arms are going to kind of be at like a 45-degree angle. And the cues for at home is think of someone with a string basically pulling your head towards the adjacent wall. So you kind of want to get, they call it long through your neck, and then you're basically just going to do a chin retraction with you in the prone position. So you will really feel those deep neck flexors lighting up, and we're trying to strengthen those, again, so you could have the perfect posture. So how it looks, again, you're going to start down low, and then you're just going to do a chin retraction against gravity. You just get a little bit more bang for your buck in this position there, too. Thanks, Phil. And that is basically the what we do to kind of correct upper cross syndrome in a nutshell. And then we'll just keep working down. So we'll go to mid-back tightness, and I'll give you some of my favorite stretches for the mid-back tightness as well. So the first one, this is called an open book. If anybody's a golf fanatic out there, I got this from, I'm called TPI certified. It's the Titleist Performance Institute. And so a lot of the stretches I give patients at home is kind of from like the golf protocol. So this is a very, very simple one. And this is one of the easiest ones you could do. It's called an open book. So an open book, you're basically going to be laying on your side, and it looks how it sounds. So you're going to start, well, if I wasn't holding the mic, arms will kind of be right out in front here. And then what you're going to do is you're literally just going to take this arm and laying on your back, and then you're going to open the book. And now my left arm holding the microphone. Some patients like to keep it on their leg to keep their legs down, or you could just keep it straight out in front of you like this, and you're literally just going to do an open book. And once you get proficient with this movement, I usually tell patients once you could kind of get the your right shoulder flat on the ground, I kind of just tell them to hang out in this position. And this is a huge for thoracic rotation. And so that is the open book. And then another one to kind of unleash some of the tightness in your mid-back is called a scapular push-up. You could actually get a lot of relief from the scapular push-up. And so I'll demonstrate this here too. So do you mind holding this one for me? So for a scapular push-up, you're going to be on your hands and knees. And the biggest thing is when people do this at home, you want to have your elbows locked. So your elbows are not bending. You're not doing a push-up like this. Elbows are going to stay locked. And think of just dropping your sternum all the way down towards the ground. You're going to feel your shoulder blades touching the back, and then you're just going to do a press up. And this is a good way to kind of strengthen that serratus anterior muscle a little bit. And then it's just going to help with a little bit of mobility in your back. So a lot of times I will get patients coming in, thanks, Phil, that are always saying that they're tight and kind of in between their shoulder blades. If you do the open book in some of those scapular press ups, that's a really, really good start just to kind of release your low back. And then what I also do in the treatment room, as well as Dr. Orbach, will do some of the pin and stretch for that as well. You get a ton of relief with that too. And then the other ones for the mid back, you could do a wall angel. It's kind of hard because I don't have a wall. But basically, what you're going to do is you're going to be butt's going to be touching the wall, and you're basically just going to go like the field goal's good, and you're just going to slide your arms up and down against the wall. I would recommend doing 10 to 15 sets of that. And again, that's going to take you from the stooped over posture to kind of a little bit more up and back, and it should really alleviate a lot of your mid back pain. And then the last one, this is my favorite one. This is a little bit more advanced. It's kind of hard to show because I have to be against the wall, but I'll try my best here. So this actually comes right from the PGA Tour. This is one of the biggest openers that they do for their mid-back. And so what you're going to do is, we'll work on right side. So let's picture the Christmas tree as a wall. So if you're going up against the wall, the knee down is going to be closest to the wall, and the knee up is going to be further away from the wall. And I would suggest you start with a paper towel roll. So what you're going to do is you're going to get a paper towel roll, and you're going to pin it up against the wall, and then arms are going to be straight out in front, and then you're going to take the arm that you're moving, and you're going to try and rotate all the way back and basically set it against the wall. Again, this would have been way easier if I had a wall to show, but basically, Phil, do you mind holding this here? Yeah, so if this is the wall, I usually tell patients to start with your hands forward like this, and then you're basically just going to open up all the way. A good rule of thumb at home is the bigger the object that you're pinning against the wall, the easier it's going to be. The smaller the object, it's harder it's going to be because you're going through more range of motion through your thoracic spine. So I always instruct patients, start with a paper towel roll to pin against the wall. Do we have a video of this? Instagram, yeah. Yeah. I was going to say it would be easier if we showed the video. But yeah, you start with a larger object, and then if you're very proficient with that, then you could kind of, just like a Lysol wipe canister, you could get that. It's a little bit smaller. And then you could even go to a toilet paper roll. If you could go to a toilet paper roll, pinning and rotating that far, good for you. That's pretty darn hard to do. So that is probably my favorite one in a nutshell for the mid-back tightness. And then now we're going to go into lower cross syndrome. So the upper cross syndrome, very prominent in today's society. And again, when we sit all the time, there's a couple things that kind of happen to your lumbar spine and actually kind of messes with your pelvis as well. So when we talk about the lower cross syndrome, I see this all over the internet, on YouTube, on Instagram, TikTok. They show the iliopsoas stretch. So to make a long story short, your iliopsoas is a muscle that is very, very important when we address any kind of low back pain. It actually attaches to a couple of the vertebrae in your low back, goes across through your body, and then it attaches to your front of your hip. And if someone's been having chronic low back pain and they've seen a chiropractor, seen a physical therapist, and they never adjust the iliopsoas muscle, that's why you still have your chronic low back pain. So when you look, and if you Google iliopsoas stretch, usually everybody just starts off, this is the how you're going to start, and they basically just say you're going to rock your hip forward, and you're going to feel a pretty significant stretch in the front of your hip. That's all right, but there's a more efficient way to do it. So when everybody sets up for this, I call it the Beyonce butt. Their butt's always pushed out. So what you could do is you start with the Beyonce butt, and then you're going to basically take your belt towards the adjacent wall, and you're basically going to stack your pelvis under your rib cage. So as soon as you just do this little motion, you're going to feel the front of your hip light up, and then you could lean into the stretch, and you're going to really, really feel the stretch in that iliopsoas muscle. I can't stress this enough. If you've been suffering with any kind of low back pain, I guarantee you if you try this at home and you stay with it and stretch this 3 to 4 times a week, I guarantee you in a month your low back is going to feel a ton better. So again, the main cue is you're going to be on a knee, Beyonce butt, and then you're going to stack your pelvis under your rib cage, and then you're going to move forward. If you want to enhance that stretch, what you could do is you could actually put your hand up and lean back in a way, and then you're going to really feel that area light up. So that's one of my favorite ones for the iliopsoas. Also, if you're going to stretch it, you kind of want to strengthen it as well. So in the treatment room, myself and Dr. Orbach will give different correctional exercises you could do to strengthen it, because if you're going to stretch it, you have to strengthen it as well. So to strengthen it, it's going to kind of be hard on this table, but very, very easy. What you could do at home is I'll have patients basically start with their back against the wall, straight leg out, and you could just grab a water bottle or a couple water bottles, and I basically say try and hit every hand of the clock. So with your back up against the wall, if this was supported, you're literally just going to work on picking your leg up and just taking it over the water bottles, and so you're basically essentially hitting different hands of the clock. So that's the best way to kind of strengthen the iliopsoas muscle after you stretch it. And then when we talk about the weak glute max, since again we sit all the time, we're not as active as we should be, so your glute max kind of turns off. So very easy things you could do to strengthen that. So if anybody's been to physical therapy, they will usually give you like a glute bridge to start. So glute bridge is you're laying on your back, heels are going to be towards your butt, and I always tell everybody you want a deep breath through your belly to kind of support your spine. So you're going to take a deep breath through your belly, and then you're basically just going to fire up, hold for a second, and come back down. And so this is very, very basic. I'm sure a lot of you at home will be able to do this lights out. If you want to enhance it a little bit, you could grab these. These are on Amazon too. These are like $5 or $10. And you're basically just going to kind of wrap it around your knees. The reason being is, so the actual motion of the glute bridge is going to fire the glute max, but you also have something called a glute medius as well. And so when you have the band around and you're kind of just having pressure into that band, it's going to fire that glute medius muscle as well. So I'll usually just have people start without the band, and if they feel completely fine with that, then we're going to tie the band around. You're going to go up, squeeze for a second, and back down. And then the hardest progression, if you want to make this a lot harder, we're going to go to one leg. So what you're going to do is you're going to go up, fire up, and then you're basically just going to hold one leg up. And if you do this properly, you will feel your glute firing like crazy. So you're going to be sore the next day, and then you could come back down, same thing, glute up, and then you're going to go straight leg and try and keep it parallel. And this is just a really good way to kind of start to exercise and strengthen the glute max and the glute med muscles. Another one that I really like is called a monster walk. I don't know if I'll be able to show the monster walk here. Monster walk is basically you're going to be tying the band or putting the band around your feet here. So, basically a monster walk is I tell everybody to kind of get an athletic stance, and what you're going to do is you're basically going to like laterally shift. So I'll go to the right side, so you're going to be in a nice supported athletic stance, and you're basically just going to go down your hallway just doing a monster walk. And when you do these correctly, you will feel your glutes, especially on the outside, really firing. And if you don't have a lot of space at home, what you could do is you could just kind of be in that athletic position, and again, you're going to hit the hands of the clock. So you could kind of just do like little jab steps, and everybody thinks it's going to be working the leg moving, but actually the stabilization leg is going to be the one that's turned on, and you're really going to feel that fire. So that is just a really good way to kind of strengthen the glute med as well. And then the other thing that needs strengthened too, core stability. Everybody's pretty darn weak in their core, and I actually these are the exercises I'm going to show you from like one of the top PTs in the country. And the big thing about core stability is your core muscles, they basically stabilize your spine. So if you go to LA Fitness or Planet Fitness, sometimes you got some knuckleheads doing some like hanging windshield wiper sit-ups, Romanian chair sit-ups. That's all said and well, but your spine's not in a stable position, so you could actually injure yourself. So the best way to kind of support your... Oh, like when you're hanging from the pull-up bar and you're basically taking your legs and doing the windshield wipers. Yeah, which it will definitely cut you up, but then your back's going to be compromised because your spine's not neutral. So if you actually look at the data in the physical therapy, the best in the country, what they'll do is they'll actually train your core with a stable spine. So this is my go-to. This is one of my favorite ones, and there's multiple ways to make this harder, but it's called a dead bug. It looks how it sounds. So essentially a dead bug, you're going to be laying on your back, and you're going to bring your legs up, and you're going to be at 90-90, and arms are going to be straight up in the air. The biggest thing with this is a lot of people when they set up, they'll kind of have a concavity in your low back. You really want your low back to be as flat as it can on the ground, just so it's going to stimulate your core and not compromise your low back. So when you get in the setup position, I instruct people to kind of squeeze their glutes and basically contract their core so your back's flat on the ground. And the best way to start with this is you're just basically going to take a heel down, touch, and come back up. So this is the lowest progression here. And then once you feel comfortable with this, and if you're asymptomatic, no pain in your back, and you feel your core, your abdominal core firing, then you could go straight leg all the way down, touch, and come all the way back up. And this is the second progression of the dead bug. And then, Phil, can I borrow a hand here? And then the next progression, we're going to get the arms into it. It's kind of hard at first. It's kind of like patting your head, rubbing your tummy. So opposites get big. So you're going to be in the setup position. Again, you want core contracted, glutes contracted, flat back. Arms are going to be up. And then opposites get big. So right leg's going to go down and left arm goes down. And the slower you do it, the more you're going to feel it in your core. And I promise you, if you start to do these and you go really slow, I guess I'll just stick with the one side. When the slower you go, the more you're going to feel it in the core. And if you just do a set of 8 to 10 of these, you will feel your core muscles like lighting up. So that's basically how to do the dead bug. And then the last progression to make it a lot harder. Grab that exercise ball back here. So the next progression where you're really going to feel this is I like to get an exercise ball or a physio ball, and you're basically going to pin it. So when we go the opposite hand and leg, so again, you're going to be in your setup posture, and when we go opposite hand and leg, you're going to basically be driving right arm and left knee, compressing the ball, and then you're going to get big. And if you just do a couple of these, you're really going to feel it light up in your core. And again, these are crazy safe for you to do because if you notice with all these movements, my lumbar spine or my spine's not moving at all. So you're not compromising your spine, and a little bit of yin with the yang. The stronger your core muscles are, the less delegation of tension and pressures that's going to go on your back. So if we're going to treat the low back, we definitely got to get some core stability. And I'll just show you guys one more time because this is getting to be a workout now. We're going to compress the ball down, and then opposites get big. And the slower you go, the more you're going to feel it. And I'll go other side. And that is probably thanks, Phil. And that is probably one of my favorite core stability exercises, the dead bug. I would start with just basically taking a heel down, touching the ground. Then you could go to your straight leg, and then you could go to the progression with moving your arms independently of your legs too. And then the next one is something called bird dog. It's kind of like the inverse of what we just showed you. So the bird dog, you're actually going to be on hands and knees. I wonder if I just hook this up, I might be fine. Yeah, because I'm going to be... Yeah, that's perfect. Okay, so this is basically the inverse of a dead bug. So this is called a bird dog. And so a bird dog, you're going to be supported on your hands and knees, and the same thing, opposites are going to get big. So when you're basically starting like this, and then the slower, the more you're going to feel it, you're going to go up, get long, and then slowly come back down. And the reason why I like this one too is there's a big balance component. So even just taking right arm and left leg off, you're going to have some core stability to balance. But then when you start to lengthen through your limbs, you're really going to feel the balance, and you're going to feel this strengthen in your core too. So this is a bird dog, and then if you want to make this one a little bit more intense, I don't have a fulcrum to tie a band to, but what you could do is you could basically get a band and loop it around your arm and your leg, and then it will increase the tension when you go up here too. So that's probably my second favorite one. And then the last one is called a Palloff press. We're going to have to use the band here again. So Phil, can you be my doorknob? So what you could do is you could basically just tie this band to a doorknob, and I'm going to scoot back. You want to scoot back just a hair? Perfect. And so you want to have a decent amount of tension on this, and the side that you're working so is going to be the side closest to the doorknob where you tie your resistance band on at home. And so you can have a decent amount of tension just for this purpose. I'm going to keep it kind of light because it's the heaviest band they have. And what you're going to do is you're going to have your feet stacked under your shoulders, and you're literally just going to take your arms and you're just going to slowly take them away from you and bring them back. And when you do this at home, you will feel what we were talking about. This is an exercise to strengthen something called a multifidi muscle. It's like a deep muscle in your low back, and that is huge for any kind of low back or lumbar support. So you're going to have a decent amount of tension on the band. And again, you're going to go feet stacked under your shoulders, and you're just going to slowly take arms away from you and then back into you. And you will feel it on that side of your back, but you'll also feel it in some of your oblique muscles, and it's kind of firing your core. So that is called a Pallof press. Not a lot of people do that, or not a lot of providers tell a patient to do that, but that's actually where I found a lot of result. Patients are having a ton of good results with the Pallof press. That's a really, really easy one you could do at home. Those resistance bands are $5 to $10 on Amazon. Just, order a couple. I would say start light. Maybe start with like a yellow or a red, and then you could progress to the green, blue, and then black's going to be the heaviest. So in a nutshell, we kind of just covered lower cross syndrome, upper cross syndrome. Lastly, what I'll touch on is, you'll get benefit doing these things at home, right? But what myself and Dr. Orbach like to do is there's also something called a PNF stretch. And in a nutshell, you could call it like a contract and relax stretch. So you could get a lot of bang for your buck doing the passive and the active stretches, some of these exercises at home. But the PNF stretch, I think, is one of the best stretching techniques you could do, just because you get the most bang for your buck. So when we do a PNF stretch, like a contract or relax, basically, so if we're going to stretch someone's hamstring, Phil, can I borrow you? Can you go head right here? And then, yeah, on your back. And we'll try and do this one-armed here. And so a PNF stretch. So like if I'm going to stretch Phil's hamstring, what I'm going to do is I'm going to pull his hamstring up, and you could go dead weight here. And so we're going to get to where you feel a little bit of a tension, and then I'm going to ask the patient, push down into my shoulder 30%. So he's going to push 30%, relax, and then we're going to go a little bit further. And let's push 30% down. Phil, your hamstrings are tight, and relax. And then let's contract and relax. Yeah, you're tight. And let's go one more, contract and relax. And so the purpose of the PNF stretch is when you actually contract and then relax, and then you're just going to get a little bit more end range of motion. So you could do this with every single muscle in the body. I know myself and Dr. Orbach like to utilize the PNF. We talk about it at lunch too, just because I feel like, thank you, I feel like that's like the most bang for your buck you could get with stretching, and that's obviously crazy hard to do on your own. I don't know. I know the stretch labs are getting a little bit more popular. I don't know if they do that over there. I know there's one in, I think, the Strip District, and I think they have one in the South Hills. I don't know if they do any PNF stretching there, but again, I feel like that is the gold standard top dog where you're going to get the most bang for your buck. Thank you, Phil. So, yeah, that's I guess that's stretching in a nutshell. Does anybody have any questions? 100%. Yeah. So if you're having any, yeah, do you take any magnesium, any supplements for it? Okay, perfect. Yeah. So I was going to say, like, anybody with any kind of muscle spasms, cramps, like when patients are like, you know what, I wake up in the middle of the night and I just feel like I have a Charlie horse in my calf. My go-to is magnesium, like our Mag Complete, just because I love it because they have the magnesium bisglycinate chelate, which is like one of the most absorbable forms of magnesium. I also like the magnesium threonate. It's a pretty good brand, or pretty good formulation as well. But yeah, magnesium. Foods, green vegetables. Yeah, just crush your green vegetables. Are you hydrated? Yeah. I was going to say okay. Yeah. 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 You're in pain stretching it? Gotcha. Yeah. So my advice would be like my pecking order. If people are having any kind of muscle cramps or spasm, hydration number one. Rule of thumb: they say take your body weight divided by two. That's how many ounces of water you should be having a day. Magnesium. If you're not taking anywhere from 400 to 500 milligrams of magnesium, try and take that. See if that has a little bit of palliation. Yeah. Yeah. I would say just kind of go through the range of motion. So like just very simple, what you could even do is while you're in the seated position, you could literally just work on just stretching your leg, just kind of taking it like this. And then my favorite way to stretch hamstrings is instead of just kind of like going down. So if you're already kind of stooped over, what you could do is you could actually even stoop over a little bit more. So bend your knees, and then you could kind of go and grab in your shin and then try and straighten your legs in that position. Yeah, yeah. Now, and one of my favorite sayings with patients is we want to poke the bear, but not make it too angry. So you kind of want to dive a little bit into discomfort, but you don't want to be like killing yourself, like, oh, I feel that stretching really good, and like, and then end up hurting yourself. But my pecking order for any kind of like muscle spasms. Water, magnesium, and then usually if those don't work, you're probably deficient in a couple trace minerals. So that's why I'll take the mineral rich or recommend that for patients if you're having any kind of like, Charlie horses, any kind of cramps in the middle of the night. Not a problem at all. All right. So did I ramble long enough, Phil? Is that pretty good? Any other questions? Alrighty, guys. Well, thanks for tuning in. That was pretty fun. That was a little bit different than me just sitting and I feel like preaching at you guys. So if anybody has any other questions or if anybody's just active, if you like to go jog 3-4 times a week, if you're in the gym, if you have any grandkids or kids, like I love treating athletes. Just had the wrestlers in 2 weeks ago, and it's really really fun working with athletes, and that's kind of just like bare minimum what I kind of just showed you guys today. With the athletes I treat, just because I have a master's in sports rehabilitation, I'm a certified chiropractic sports physician. Working with the athletes, we really amplify that, and then we also have something called a vibration plate back there. And so if anybody's having any kind of like tendonitis, tendinopathy, or any kind of aches and pains, or their range of motion's deficient, they're lacking, I'll literally throw them on the vibration plate and take them through a range of motion, and you get a lot more bang for your buck there too. So I wanted to give you guys some clinical pearls, if you will, that you could do at home just to kind of keep you moving and grooving, so to speak. But let's face it, sometimes you need a little bit of additional work, and that's where we do the magic in the room there. So, alrighty, guys. Yeah, thanks for sticking around, and we will see you back in March, right? March 1st and 2nd. So we will talk to you guys soon. Have a good one. Yeah, thank you. Thank you, thank you. Yeah,